Okay guys, so I'm going to pick up where we left off earlier this morning so that we can finish up via voiceover for this structure and function content and be able to jump right into the alterations on Monday. So we finished up here with the hepatic portal circulation and discussing how the liver receives blood both arterially and from venous sources. Again, one thing I really want to stress here is that the metabolic function of the liver requires a large amount of blood. Interestingly, it receives about 25% of the overall cardiac output because of its major sort of filtration and detoxification, role that it has. The hepatic portal vein that we talked about earlier this morning carries a little bit of oxygen and is certainly rich in nutrients that are absorbed from the GI tract. But in terms of where the liver really gets most of its oxygen and most of its nutrients is from that arterial side of things. So I just want to sort of be clear about that. And then again, as I mentioned as we were sort of finishing up this morning, that the capillaries in the liver are called sinusoids. This is where the blood drains to a central vein in the middle of each liver, sort of lobule, from these arterioles and these venous, highways, so to speak, that are going into the liver. They drain into these smaller sinusoids that are located between the hepatocytes and receive that mixture of both the venous and the arterial blood for the branches off from the hepatic artery and the portal vein. So just wanted to be clear about that. Then venous blood from all the lobules then flows into the hepatic veins, which empty into the inferior vena cava, which then obviously takes it back to the heart. So I just wanted to kind of be clear about the flow of how that all works. But yeah, so the liver is certainly responsible for all that detoxification. The venous side of things, the hepatic portal vein, is certainly responsible for directing blood from parts of the GI tract to the liver, as we discussed. Substances absorbed in the intestines travel first to the liver to be processed before continuing to the heart, which we did discuss. Specifically, even things like drugs absorbed in the GI system, drugs and alcohol get metabolized in the liver as well. So again, just that step of cleansing, because the blood from the GI tract is certainly dirtier than the blood coming from other organs in the body. Okay. Let's see if there was anything else I wanted to say. Okay, so yeah, so that's kind of basically all from that slide right there. The other thing I will sort of quickly picture and quickly mention here is, and we'll talk about this on Monday when we talk about alterations in liver function, but if there is some type of inflammation or some sort of almost hypertension in the liver itself, so with sort of backup or hypertension within this hepatic portal vein here, you can see how it would cause a lot of problems with backup of blood into all the other organs. So if there's hypertension or inflammation in the liver, this blood's going to back up into this hepatic portal vein, into all of those organs that we talked about today. So into the stomach, into the esophagus, into the colon, into the pancreas, into the spleen, into the small intestines, where you can actually see, and again, we'll talk about this next week, but where you can actually see hypertension in this vein that actually causes these veins to sort of bulge, almost like varicose veins. In these organs, which can cause a lot of increased risk for bleeding in these organs. And we'll talk about that, as I mentioned, next week. But I just wanted you to be able to visualize sort of why that occurs, why you see these varicosities in these veins, in these abdominal organs, if there's some type of backup or some type of pressure or hypertension or inflammation here in the liver. I hope that makes sense to you of how and why the blood would then back up in the portal circulation. Okay. Just a little bit more of a discussion regarding the structure of liver lobules. So you have the bile canaliculi, which are the small channels that actually conduct the bile outward to the bile ducts and eventually drain into the common bile duct. You also have the major duodenal papilla, the sphincter of Odde, which actually dumps the bile into the duodenum. So, once the bile leaves the liver and goes to the gallbladder, then you've got this, as I mentioned already when I showed you the picture this morning, of this sphincter that actually dumps bile right into the duodenum. We talked about that. Again, sinusoids are the capillaries in the liver. They consist of very highly permeable endothelium. They enhance transport of nutrients from those sinusoids, or from those capillaries into the hepatocytes. To be clear, bile is produced by the hepatocytes in the liver. So I just wanted to be clear about that. And then a big sort of component of these sinusoids are cells called Kupffer cells. These cells are part of something called the mononuclear phagocyte system, and we'll talk about that more when we talk about the circulatory system. But what I really want you to know about these Kupffer cells within the liver, within the sinusoids of the liver, is that they play a really important role in sort of destroying any sort of intestinal bacteria that gets there, and also preventing infections. And they also play a really big role in sort of cleansing the blood. So the mononuclear phagocyte system, which we'll talk about, like I said, in the circulatory content, is a system that cleans the blood, that gets rid of old or dead or damaged red blood cells, and that happens. A big area of where this happens is in the liver. So in the liver, old red blood cells are absorbed and destroyed, and sort of cleanses the blood of old, sort of broken down blood cells. So that's also a big sort of role that these Kupffer cells have within the sinusoids, is the cleansing and the getting rid of red blood cells that have been broken down and destroyed. And again, we'll discuss more about this when we talk about circulatory cells. But again, also really important that these Kupffer cells play an important role in destroying intestinal bacteria and preventing infections, because, again, the liver receives all that venous blood from the gut and from the pancreas that may be dirty. So keep that in mind. Okay. Last but not least, continuing with our discussion of functions of the liver. Very quickly, the liver assists intestinal digestion by secreting about 700 to about 1,200 milliliters of bile a day. And the reason that bile is so important in why it's sort of formed by the hepatocytes is that it is required, and we mentioned this already earlier today, it is required for the intestinal emulsification and absorption of fats. So that is why bile is so important, and that's why we are so concerned about proper liver functioning, because bile is required for the intestinal emulsification and absorption of fats. The liver has a very sort of unique recycling circulation in terms of these bile salts, so enterohepatic circulation. Most of the bile salts that are sort of made by the liver are absorbed in the terminal ileum and return to the liver through the portal circulation for resecretion. So I think that's kind of interesting and fascinating. I always want to make sure I include that little tidbit of information, and that bile salts are actually kind of recycled, and once they've sort of been put into the small intestine for emulsification and absorption of fats, and then they kind of get reabsorbed back up, get back into the blood to the liver, and get recycled again to be basically resecreted back into the small intestine. So very, very interesting, unique recycling of bile. And then, last but not least, the metabolism of bilirubin. So we've talked about bile and its importance in the GI system, but we haven't really discussed this issue of bilirubin. So to be clear, bilirubin is a byproduct of the destruction, or so to speak, the breakdown of old or sort of aged red blood cells. Old red blood cells are absorbed and destroyed by those Kupffer cells in that mononuclear phagocyte system that we talked about a couple of slides ago. And bilirubin is what gives bile that greenish black color. It's what bilirubin is what makes our stool the color that it is, that brownish color, and certainly what also produces that yellow tinge of jaundice in people who have some sort of alteration with their liver, and gives them that yellow look to their skin, to their sclera, to their mucous membranes. So also, major function of the liver is the metabolism of bilirubin. And again, bilirubin is a byproduct of the destruction of those aged red blood cells that get sort of destroyed and taken out of the blood through those Kupffer cells in the sinusoids. Okay. All right. All right, I'm unfortunately going to have to stop the recording here and restart in just 1 minute, but I will continue again with the rest of this content for the rest of the slides again so that we can just jump right into alterations on Monday. Thanks guys, I'll be right back.